So if a person tests positive and maybe they take the test 3 times, so they test positive 3 times, is that counted as 3 separate cases?
No, we count people who have the disease, not test results. So for some reason, I don't know why somebody would continue to get tested, but if somebody got tested more than once, before we report a case, we assign it to a person, and if the person has already been diagnosed, we don't count that as a new case.
Okay, because that's one we keep hearing over and over again. It's like they're telling people multiple times.
There's lots of rumors.
Yeah, there's a lot of different kinds of tests out there. I understand it's confusing for folks out there, but we're really, when we're counting cases, they're really related to the diagnostic tests that are performed largely by Bozeman Health, but also by some of the urgent cares. They're called PCR tests. And they really look for the genetic material of the virus that causes COVID-19 specifically. And so the antibody tests that are out there, I really caution people to be careful about spending their money on those. There's a lot of them out there, and there's more limited utility when you're dealing with those antibody tests. But when we're counting cases at the health department, those are the PCR tests, preliminary chain reaction tests that are being run, that are looking for the genetic material of the virus that causes COVID-19. And there's one other kind of test that's being run at one of the urgent cares here in town that we're using as a diagnostic test. So it's really important that people understand that there's more and more products out there. Really read the fine print carefully. Consult a trusted healthcare professional before you jump into that.
We're talking with Matt Kelley, Gallatin County Health Officer, with tests. When a person tests positive, is it possible that they have antibodies from like a cold or something else other than COVID-19, like another coronavirus that's not actually COVID-19?
Yeah, you're hitting good questions. I'm glad you're asking them. So there's some confusion out there. With the tests that I was just talking about, the PCR tests and the antigen tests, those are specific to the virus that causes COVID-19. So there's not a risk of confusion there. Where I think sometimes people get confused is when you go in, often when you go into a doctor, they'll run what's called a panel of tests. And there's a respiratory panel of tests that predates the COVID pandemic. One of the tests in that panel of tests is a coronavirus that looks for the common cold. That is not what we're talking about. When we're talking about COVID-19 diagnosis, that panel of tests, that the Texas Common Cold is a completely different kind of test, is completely sort of insulated from the testing that we're talking about. But the PCR testing that you're getting when you go get the swab up your nose to test for COVID-19, there's not a danger that that's going to get mixed up with a common cold.
So the spike that we're currently seeing in COVID-19 cases, why is it we're having a spike if we're wearing masks? That was probably our number one question that we got.
Yeah, it's a good question. I think what we saw, especially in late July, after the mask rules were put in place, we saw a really significant drop in cases that lasted until September. And we think that the masks were a really important part of our success in reducing those cases at that time. But it really wasn't the only factor. And while masks get a lot of attention, they're really one piece of a much larger puzzle. And in order to reduce spread, we need people to do a lot of different things, including wearing face coverings. But we also need them to avoid large crowds, maintain social distancing when they can, stay home when they're not feeling well. And I think the surge that we're seeing now is happening for a variety of reasons. But the biggest reason is that the state and the communities all around us and states all around us have had higher case numbers and higher hospitalizations for several weeks. It's kind of like rising floodwaters. We've got high cases in the Dakotas, in Idaho, and Utah. Billings and Yellowstone County has been having really difficult time controlling spread for quite some time. The same with Great Falls, Cascade County. We're seeing it in Flathead. And really now we're actually seeing it in some of the smaller rural counties. And so it's kind of like the tide is coming in, and so the sandbags can only work for so long before we start to see the water coming in. That doesn't mean, though, that masks don't work. It just means that they're not the only solution, and they can't be thought of as a silver bullet. They're a piece of a puzzle. They're an important piece. They're safe, they're inexpensive, and there's something everybody can do to protect themselves and their neighbor. But we need to also continue to do those things like avoiding crowds and practicing social distancing when we can, washing our hands, and really staying home when we're sick.
So if masks do work, could it be possible that if most people are wearing them incorrectly, touching their face more, especially while not washing their hands, that masks actually could be contributing to the virus rather than helping control it?
Proper use of the mask is super important. I'm glad you asked the question because it's really important that people wash their masks regularly and they avoid touching them whenever they can. What we are seeing, though, in the scientific literature is evidence that where face masks are put in place early and where there's a social acceptance of those masks, those countries have lower mortality rates. We're seeing studies where mask use reduces disease spread. And so while, again, masks are not the silver bullet, even though they get a lot of attention, they can't solve all problems. They're just part of everything we do. And it is important that people use them as carefully as they can, that they wash them frequently, and that they try to avoid touching them. But we can't expect people to be perfect, and we know what we're seeing in the evidence is that even if we're not perfect, they do serve a purpose.
How come we didn't wear them for the flu?
Well, number one, the flu was a virus where we have other weapons. We have vaccine. We have built immunity through years of being exposed to the flu, and we do use them in some settings, like in long-term care settings and settings where you have people who are especially vulnerable. It may be something that people should consider in the future, where they know somebody in their household has the flu, but it's not something that we've done, and it's not something that's been built into our culture.
All right, one last question for you. I'm sorry we've took this much of your time,
no,
but we really appreciate it.
No, I'm enjoying it.
Our last question is, since we know that the virus is more likely to kill someone with underlying conditions, why hasn't the health department emphasized overall health care more? For instance, why is there not concentrated on exercise and there's no mandates on certain types of food or drinks?
Oh, that's the curse of public health. We've been working in that area for years and years. We have programs that help seniors exercise. We have programs that help children and young families eat well and get exercise. We have resources to help people get screening for cancer. We have immunization services that can help prevent communicable diseases and some types of cancer. We're working in behavioral health to build the ability of professionals in daycares and other settings to be able to deal with behavioral health issues in kids that predate COVID. So I would encourage people to go to healthygallatin.org. I appreciate the prompt. We have programs. We've been working in those areas, and one of the reasons we've been working in those areas is because we know when you have one of those risk factors, and there's a lot of people who have those risk factors: high blood pressure, diabetes, pulmonary disease, asthma, those kinds of things, cancer. When you have those risk factors, they're more at risk to things like the flu, to things like COVID-19. We've been working on that for years and years, and we would welcome anybody who's interested to go to healthygallatin.org and check out our programs.
Just so you know, just from a resident of the county, I feel like that message, it's all masks right now. Like there's no other message out there saying, hey, we got to be healthy.
That's where we need your help, Dave. We need you guys to talk about something other than masks. It's absolutely the case. I mean, I think that I agree with you. I think we spend too much time obsessing about masks. They are important. They are important, but it's also important that we eat well. It's also important that we take care of ourselves. It's important that we get exercise. Absolutely the case, and I would welcome you having those conversations on your airwaves, and I'd welcome others having those conversations as well.
Well, and I even feel that even washing your hands has kind of been lost in the mask message.
Yep. I agree. It's very difficult because when I get called by reporters or when I talk to people, that's become something that we all want to talk about. I personally think that distance is the most important thing. If we can keep distance from others, and it doesn't mean you have to keep social distance. We talk about physical distance is what we're talking about, and so we really I agree with you. I think we talk too much about masks. We obsess about it. It's just part of our sort of a cultural phenomenon we have. I think the fact that we're in an election year probably doesn't help. But I agree with you. I would love to be talking about those other things.
All right, it's Matt Kelley, Gallatin County Health Officer. Just want to say, Matt, you're welcome on our show anytime. If there's information you want to get out there to the public, we're a great way to do it. And we would love to have you at any point.
I appreciate both of you, and I hope you have a great day and stay healthy and keep wearing those masks and keep that social distance, and we'll get through this together.
And wash
You
your
too,
hands.
Matt.
Absolutely. Wash your hands. Eat well.
You
All
too.
right, Matt, thank you.